Okay. So we can go ahead and get started with our first presentation on Sufi music with makams for people with mild to moderate levels of depression and anxiety by Rumeysa Noor Gürbüz-Doğan. I'm sorry if I mispronounced your name.
It's all right, no worries.
Okay, you can go ahead and share your screen.
Yeah, sure. I think you are able to see my screen now. Yeah. Let's go. Okay. Bismillahirrahmanirrahim. Welcome everyone. First of all, I'm Rumeysa Gürbüz-Doğan, and I'm presenting this presentation from Turkey now, but I have just finished my PhD in the UK at UCL, Division of Psychiatry. Today I'm going to talk about my feasibility study. Start with introduction, then aims and objective, methods, results, and finish with a conclusion. First of all, I would like to explain what Sufi music with makams. It is a receptive music therapy, which means participants only listen to music, don't produce any musical pieces during the therapy sessions. And it is an instrumental one. There is no words or no songs during the session. It combined with water sound has a makam, which means musical modes. We will talk about the next presentation. My colleagues will talk about on the makams, and it has a specific instrument, which is ney. It is very popular Sufi instrument among the Mesopotamian land. Let's just first listen a bit the music. I hope you can hear in a second, and then we will move on to the rest of the presentation. Can you hear it? Yes, yeah, this is our Sufi music, and the instrument you see on the screen is the ney. First of all, I would like to just mention a little bit about history of makam music therapy, actually. So it will start with the first psychiatric hospitals in the world. In the psychiatry history books nowadays, the modern history books, it is just said the first psychiatric hospitals in the world established in London around 13th century, which called as Bethlehem. However, we can see there are plenty of hospitals which has at least a ward for the psychiatric patients, or established as a psychiatric hospitals for the people with psychiatric disorders in the Anatolian and the Mesopotamia lands. It started with the 19th century Ibn Tulun Hospital in Cairo, Nurettin Hospital, Syria, Divri Hospital, Turkey, which most of them has the music therapy sessions following the 12th century. You can see at the middle of the wards, there is a water fountain, and all the music therapy session just combined with the water sound and the natural sounds like the birds or the tree sounds around the establishment, and patients just get benefit from those therapies in those hospitals. Another one, Kayseri, Turkey, Yevhernesi Hatun, you can see the fountain in the middle of the ward. And Aleppo, Syria, again, fountain, water. And Edirne, which is the Europe side of the Turkey, 15th century. So my aim in this project is just see whether Sufi music therapy is feasible or unacceptable as an intervention in reducing symptoms of depression and anxiety and improving mental and spiritual well-being. We have run a preliminary examination of the effectiveness of this therapy as well. I will give some detail about how we apply this intervention. First before the detail of the intervention, I should mention how we came out to the guideline for this intervention. I run a systematic review of the literature and meta-analysis, which shows this music intervention applied without any guideline for the practitioners. Therefore, I have to build and develop a guideline which is followed MRC Medical Research Councils of the UK framework for evaluating and developing a complex intervention framework. So according to this, there is several steps I should take, like the theoretical framework of the literature, a qualitative study which was run in the UK into Turkish center, one in Newcastle in the north of the UK and one in London. Then I have a manualized intervention which is applied in a pilot feasibility study to see whether it is feasible or acceptable for people with mild to moderate level of depression and anxiety. In our intervention, I recruit 60 people and randomly divided into two groups, which one is the intervention group received the Sufi music therapy in a quiet room in the community centers, again in two community centers, one in Newcastle and one in London. And the second one is the control group, who are just in the waiting list, and they just continue to their regular program services at the community center. As an outcome measures, we use validated outcomes into community, one in the British community and the one in the Turkish community, which was our main criteria to apply to find out the measurements in the areas. And there are 5 measurements. One is the demographic one, and for depression and anxiety, we use the PHQ-9 and GAD-7. And mental and spiritual well-being, I use the Warwick-Edinburgh mental well-being scale and Facet spiritual well-being scale. As an inclusion criteria, it is just being 18 years and over, and was able to read and understand Turkish or English, and had at least mild level of anxiety and depression or both. Participants who would like to attend the sessions, if they don't have any anxiety or depression, or if they have severe level of anxiety and depression, they were just excluded from the study. We have 4 time points, which was at the baseline, at week 2, week 4, and week 6. At the week 6, it was the follow-up measurement time points, actually. When we look at the intervention design, it was designed as a one-to-one session. It started with a storytelling as an ice-breaking activity. I just choose the Sufi stories, which has a connectedness with the music itself. So, but of course, in the following future studies can choose different ice-breaking activities as well. It follows with the 15 minutes of music listening. Participants just asked to close their eyes, and they just follow the music's harmony if it's just where it takes them to. And then we just finished all the session with 5 to 10 minutes of talking about feelings, emotions evoked by the music. This part of the session actually quite the personal. If person don't want to speak anything, they can leave the room. It was optional, and it takes 4 weeks. Once a week people attend the session at the community center, and community center just provide us a very quiet room. When we look at the demographics, we can see most of the participants were female in the music group, and they are mostly, we can say, the young age, and most of them Turkish, so they have a cultural bond with the music. And we can see some of them, 23% of them attend the Sufi group regularly, which is also another parameter which shows those people may have at least once in their life hear this music, even though they live in the UK. Surprisingly, we can see all the participants, the recruitment and retention rate of the participants is very high, and only 2 of the participants drop out from the stations, which shows us actually all the therapy just seems very acceptable for the participants in our community centers. And however, in the control group, as they are just in the waiting list, it is very low level of the retention and the recruitment rate. When we look at our mental health outcomes, I'm really sorry about the background noise. It is very promising, actually. When we look at the detailed results from the study, it can be shown our linear regression shows very statistically significant results from the study, as apart from the depression. As you can see, it is 0.8 p-value. And when we compare the baseline values to the 4th week values, it is just seems, apart from the depression, all the other outcomes seems very promising. So when however, at the 4th week time point 3, the orange one is the control group, shows the control group. At the 4th week, after 4th week, all the parameters just going to their original values, which is shown at the T1 baseline. And as you can see, spiritual and mental well-being as well, they are going to drink during the therapy sessions, they are just flown. They have a decreasing trend, but after the T3, they are starting to increase again. So as a conclusion, the intervention seems feasible and acceptable for the people who have interest towards the Turkish culture, who live in the UK, as the recruitment and retention rates very high. And also participants have found the therapy helpful, but in short term. At the end of the therapy, at the 4th week, I have just asked a single question to them. If anything you would like to change during the therapy, would you like to change it? They have said no, everything fine. However, I would like to change maybe the environment of the room. You know, maybe there is some kind of sense, or maybe some flowers around. And apart from this, they found the all the therapy sessions very helpful for them, their anxiety and depression, and also spiritual and mental well-being. Even though the clinical outcomes illustrate a statistically significant positive effect of Sufi music therapy, after 2 weeks, the follow-up time point, these effects just disappeared. And as a conclusion, I can say further clinical trials, full trials should be done to make a strong conclusion, even though our study just shown very promising results. So I have, of course, limitations as like all the studies. First of all, the population, as I said, population have some familiarity with the music itself, so this can be you know, a reason why this music works for them. And also the settings, they are regularly attending those community centers for the spiritual purposes. They came to there and get some spiritual classes in these communities. Maybe this is why this have an effect on them, their spiritual well-being, maybe increase, you know, adding to the music as well. And I have the researcher biases as well, as they regularly meet with me in the centers, because I am a volunteer worker in these community centers, and I am giving regular spiritual classes at those centers. This may be effect to them, and most of them know me, and this also may just increase their well-being and decrease depression and anxiety. And also, as I said, the participants' cultural bond with music type is quite important point in here, and we should just be cautious to make a strong conclusion from our study. So thank you very much for your listening, and I'm sure my colleagues for the next presentation will enlighten you about the makam music. And if you have any question, please ask now, or you can just email me from the email address I provided for you. Thank you.
Okay, thank you for that presentation, Rümeysa. I think we're going to save the Q&A and discussion till the end of the panel. So we'll go ahead and move on to the next presentation on music therapy implementations for mental health in the 17th century Ottoman era with Elif, Bestenigar, Mert, and Merve Nursoy-Demir. Go ahead and get started when you guys are ready.
Can you see the screen? Slide? Yeah, okay, presentation. Great. Assalamu alaikum wa rahmatullahi wa barakatuh. This is Merve. Today, inshallah, me and Besta will present you about our work from Stanford Muslim Mental Health Lab. It's basically a medical treatise from the 17th century Ottoman era, which has a separate section on music therapy. So I hope that with Rümeysa's presentation and ours, it will present a good, like, complete sense of past and today of the music therapy in the Islamic tradition. So as I said, we will be focusing on the medical treatise from the 17th century, which is named as Tadilul Emzice fi Hıfzi Sıhhatil Beden, which means that adjustment of temperaments in protecting health of the body. It was written by a 17th century Ottoman physician who was a head physician, actually, a royal physician, Hasan Şuuri Efendi. And the book has a separate section, a chapter on how to use music for psychological and physical illnesses. This is actually an early example of how to formalize music therapy for mental health. When I say early, as Rümeysa briefly mentioned about the history of makam music, I mean in comparison to the modern practice of music therapy for the mental health, and also in comparison with the European history of music therapy, because the earliest medical texts we see, like in the medical sense, we see in the 18th century is the earliest time that we see music therapy in the medical field in Europe. However, if we compare with the rest of the Islamic tradition of medicine, this is actually a comparably recent example, because we know that, as Rümeysa mentioned, we have earlier records of the music being used for the mental health in the hospitals. So what is our aim in presenting you this like more than 400 years of manuscript? First of all, we aim to present this by a historical model of holistic mental health approach that was rooted in the Islamic tradition, that was advanced for its time. And it is also part of our efforts in rewriting the history of our current mental health practices and to go beyond the limited perspective of the Eurocentric rhetoric, because today, if we see the literature on history of psychiatry or psychology, and specifically for music therapy, this is true as well. We don't see contributions of the early Muslims, basically none, well, if you are lucky, just a few. And it's basically a linear rhetoric from ancient Greek coming directly to the European medicine. So we do this presentation as part of this effort, and we want to acknowledge the previous Muslims' contributions to the field of Muslim mental health. So before Beste presenting you the actual manuscript, I want to give you a brief historical background about the medical context in the Ottoman Empire. So in the 17th century, Ottoman Empire was a world power, a political power, one of the largest ones actually in the world. And it encompassed a large geography from Eastern Europe to Anatolia to Arabian Peninsula, North Africa. So it had a diversity of people, cultures, and religions. This diversity was also a characteristic of the Ottoman medicine. So historians define it, the Ottoman medicine, to be integralistic, holistic, and pluralistic. What I mean by integralistic, that Ottomans were very comfortable with integrating earlier traditions, elements in terms of medicine, depending on their needs and the context of their medical system. And they were also holistic in their perspectives in understanding health and the person, and their treatment and diagnosis approaches were perceiving person with the spiritual, physiological, and psychological well-being together. And it was also pluralistic in the sense that there was a mainstream medical infrastructure that included the hospitals and the officially assigned physicians, but there was also a folkloric medicine and also prophetic medicine being served to the society. The mainstream medical infrastructure was defined to be empirical, pragmatic, and secular, rather than being mystical or philosophical. And this is also an important characteristic of the Ottoman medicine and in general Islamic medicine. Also, we see from the historical sources that using sounds for treatment, these were either water sounds, bird songs, or the makam music, as Rümeysa mentioned, was a signature of Ottoman medicine. And so by the time Şuuri, Hasan Efendi was writing his book, we can say that he was placed at the center of a world empire with a diverse society and equally a diverse medical infrastructure, which was still at the height of its power. But also at that time in the 17th century, it was also experiencing some deficiencies in the system. So there were some initial discussions about the reformation efforts. So it's, I think, important to keep in mind. Before going into the book, just briefly mentioning music in the Islamic tradition of medicine. Rümeysa also mentioned very briefly, but makam was the key concept here in defining the music, as some of us already very familiar maybe, but a makam is the core element in defining the music. We know that a variety of makams were used, and makam is basically a predefined system used as a skeleton in performing music, and it defined the music's like dominant notes, the intervallic structure, or the melodic progression. So at the time, Ottoman physicians had an analogy between the rhythms of the body, especially the pulse, and the makams, and they were very good at catching diseases and symptoms of illnesses by monitoring the pulse. And this is not for the physiological illnesses only. They were able to catch the anxiety, for instance, or the fear, or like any other similar psychological problems through monitoring the pulse. And they believed that they could regulate these irregularities in the pulse by implementing specific makams. And they were doing this based on the patient's specific needs in terms of the diseases or their personal characteristic or at the environmental structure as well. So you can see a picture of Süleymaniye Darüşşifa, interior of it. And this was one of the places that music was known to be performed for the mentally ill. We have a couple of like traveler accounts, both local and also foreign, who observed the actual performances of music within these hospitals. And we also have a broad literature on the theory of musical healing, so suggestions about how to use makams and etc. Now, Beste will present you, inshallah, more about Şuuri and his book.
Assalamu alaikum. I am Beste. So considering our title of the presentation, I'm going to give a detailed information related to Hasan Şuuri Efendi and his manuscript. Even if we have insufficient information about his personal and educational background from the Ottoman archives, we know that he served as a hekimbaşı between 1690 and 1693. The meaning of the hekimbaşı is a person who is Minister of Health and the head of the royal physician at the same time. Hasan Şuuri Efendi was a prominent medical doctor, poet, and a linguist. He published 5 works, but we know him from his contribution by including music into the medical literature. From the Tadil-i Emzice, from his manuscript, we know that he has a strong understanding that the purpose of the medicine is not only heal, but also it's based on how to sustain a healthy life as well. So I'm going to give more detail about Tadil-i Emzice. It's a medical treatise and written in 1671. It consists 130 pages. You can see the first page of the Tadil-i Emzice, right side of the presentation. The book was presented to Grand Vizier Köprülü Fazıl Ahmet Pasha. Köprülü Fazıl Ahmet Pasha was the second most powerful man after the Sultan at the Ottoman era, in the Ottoman Empire at that era. Today, there are 12 copies survived here, and we can understand that the book received considerable attention among the Ottoman scholars because in that time there is no printing house in Ottoman Empire, and all of the books have to be written and reproduced via handwriting. Before mentioning how Şuuri Hasan Efendi used music as a tool, I'm going to give a little bit detail about the Tadil-i Emzice. The book consists of 4 main sections. The first section is like an introduction of the book. It includes some information related to human anatomy, organs, and their functions. The second section is the largest section of the book, and he provides a holistic understanding of preventive medicine and also some topics related to how a person sustain his or her physical and psychological health, such as he mentioned about physical activity, importance of the physical activity and sleeping, hygiene, and most importantly, music interventions during the treatments. And in the third section, he gives information related to characteristics of healthy sexual life. And in the last chapter, we see some themes like childbearing, diagnosing pregnancy, and detecting infertility. In the music chapter of the Tadil-i Emzice, the book dedicated the use of music for both preventive and creative medical purposes. As just Merve said before, regular pulses and the blood circulation is the main thing in the Ottoman music treatment process. And Şuuri claimed that in Tadil-i Emzice, he claimed that depending on patient's physical and mental condition, there is a makam that regulates blood circulation. He also emphasized the knowledge of music is very important for physicians because if they know how to use music during their treatment, they can excel their practice both in diagnosing process and the treating process as well. So while Şuuri used music in both diagnostic and the treatment process, he used makams based on personal characteristics of patients. environmental characteristics and characteristics of makams. He implemented the music, as a first one, he implemented the music based on personal characteristics of the patients. They look at the characteristics of the patients, such as his or her temperament, ethnicity, physical appearance, or occupations. And he wrote a prescription based on his or her characteristics, such as he suggests that makam Rast can be implemented to scholars, whereas makam Isfahan can be implemented to chief commanders, or makam Hijaz can be implemented for dervishes. As a second category, prescription, before the prescription, Şuuri also considered the time of the day, weather, and the seasons as well. And as a third one, according to his understanding of the music, he believes that all makams has a specific nature and disposition, and all of them is sort of really associated with the astrological categorization. However, most importantly, he provided suggestions for using makams based on specific illnesses and symptoms as well. So here you can see a table. Yeah, we create this table after check the whole music chapter. And he provided, there is a 14 makams, and he suggests some implementation for 14th makam and specific illnesses and symptoms. These illnesses and symptoms can be both physical and psychological as well. Let me give some of them. For example, makam Irak can be implemented during the somatic anxiety symptoms, or makam Isfahan can be implemented for enhancing memory and cognitive abilities, or makam Büzürk can be used for fear-related disturbances, or makam Uşak can help in insomnia and relaxation. Until now, Merve and I talk about makam and music so much, and that's why I would like to introduce one of the makams to create a better imagination for you. You already listened from the Rümeysa's presentation, but it is a little bit more makam-based music. And we will listen a short piece of makam Büzürk, which was used for fear-related disturbances. But think yes, this one is the contemporary version of the Büzürk makam, not the one used by Şuuri, Hasan Efendi. Can you hear? So.
So as a conclusion, couple of items. We see in the book of Hasan Şuuri, it provides a good and exceptional insight into the Ottoman physician's perspective about how to use music for physiological and psychological problems. As I mentioned earlier, we had already historical accounts from witnesses writing about how they observed musical performance in hospitals, or we have a broad literature actually about how to use makams for health. But little has been found on music therapy that was directly attributed to a practicing physician. So this manuscript is in a way significant in this terms. Also, Şuuri is serving as one of the highest ranking physicians in the Ottoman Empire, adds value to the manuscript, and his recognition and emphasis on the use of makams for preventive and curative medicine indicates that musical healing held a central rather than marginalized position in the Ottoman medical knowledge. And We also see that the treatise provides an example of the holistic approach Ottoman physicians held. As we mentioned earlier, physiological and psychological well-being was perceived as a whole. And we see this in the manuscript as well. We see curative and preventive discussions blended together, and also physiological and psychological illnesses and their treatments presented side by side. And also we see that music was defined as a medical tool that was believed to be effective on the physiological level, on the body, but at the same time, on the psychological and spiritual well-being of the individual too. So they were all discussed side by side, so to say. Also, Hasan Şuuri's writing illustrates a medical approach that was focusing on the patient as an individual rather than the disease. Beste mentioned that how he discussed in detail the personal characteristics, environmental characteristics, etc. So all of these factors were included in defining the diagnosis and treatment processes. Also, they formulated diagnosis and treatment empirically rather than spiritually or supernaturally. When I say empirically, I mean that they based their practice on observation and experience rather than some philosophical knowledge. Also, we see that that he incorporated interdisciplinary knowledge. He used other fields of knowledge when practicing medicine. For instance, MPhil is a field that was used at his time, analyzing the physical appearances of people and how it affects their health, etc. And also astrology, musicology, and mathematics, and sometimes philosophy, theology, etc. They were all used to understand and benefit the person as a whole. So here we try to present you a historical example of how music was implemented at the time of the Ottomans. And it, as I said, it's kind of important to see written by a head physician who was the #1 physician of the time. I hope you enjoyed our presentation, and I'm happy to answer any questions you might have. Thank you for your attention.
Okay, thank you for that presentation. We can now go into discussion with Dr. Rania Awaad.
Assalamu alaikum. Warahmatullahi wabarakatuh. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. Thank you so very much to Rümeysa, to Merve, and to Beste. This has been a wonderful panel to really understand about a really topic that many of us have been wondering about. And there's been quite a bit of discussion on how music really plays into the Islamic tradition and in the therapy process itself. And so what I'll do is just a recap on some of the main points that we heard today together, but really what I hope to do, and I ask all of our audience attendees to please start putting questions and comments into the chat box so we can actually have more of a discussion based around this topic. To begin, some brief reflections on what we heard. We began with Rümeysa, who actually was talking about a trial in which she was taking music therapy from the Sufi tradition, so Sufi music, which she had us hear some of, and actually play some of this for groups of people at the community center to see whether or not it was going to be improving their mental health state. And she used the PHQ-9 for depression and the GAD-7 for anxiety to see what kind of effect was happening. And really, could you do this in modern practice in modern times? So Rümeysa had a really wonderful modern day example of how would you implement something like this based on historical roots that, of course, Merve and Beste both talked about the historical roots and showed us historically what this looks like for the Muslim community, which we'll get to momentarily. Now, what was so interesting to me, Rümeysa, and I hope you're able to join us in this conversation, is I was very intrigued by how you said that there were people who had a very positive effect to this, and a calming effect that came from listening to the music. And I know that you had been very interested on repeating this study again in populations other than the Turkish population, because these were people of Turkish origin who were living in the UK, to my understanding. Is that accurate?
Sorry, yes, yeah, it is. So the future study plan is applying this music intervention in the population rather than the Turkish, probably the Muslim population but not Turkish ones. So we are planning to do with the Stanford Muslim Mental Health Lab, inshallah.
Inshallah, inshallah.
Yeah.
We are currently awaiting this IRB process, but it'll be very intriguing and interesting to see what happens. And I might even further say it would be very interesting to see both, of course, in modern times, but also historically, what would happen if we took some of the same treatment modality and used it even with people who are not of the Muslim faith? Would it be calming to them as well? And that would be very interesting to see, because the entire discussion, and this is a panel on essentially Islamic psychology, bringing in Islamic origins and roots into the modern day therapeutic process, and kind of back to indigenous roots of some of the findings that we looked at historically, which we'll talk to Marwa and Besta in just a minute here, on what is it that Muslims used in their healing process. You know, sound therapy, or music therapy as it's commonly called now, being one of those functions. And so, but many people in the field of Islamic psychology, as an interesting point here, feel that these modalities, because Islam is a very holistic tradition, actually speak about how all of these different practices could actually be very useful even for people not of the Muslim faith, or people even of no faith at all, because they talk about the holistic human as in all of our senses as humans, and incorporating that into the therapeutic process. So I very much look forward to see what comes of your studies into the future, and congratulations on completing your PhD just recently.
Thank you. Thank you very much. Thank you.
Wonderful, wonderful news. And now I'll give some reflections on Marwa and Beste's topic, which what took us backwards into the 17th century. And it was so wonderful to hear, because you all know, for me personally, how much I enjoy the historical discussions related to mental health, and how, to me, that's a very important piece of the puzzle that I feel that modern day mental health clinicians, psychiatrists, psychologists, therapists, etc., have maybe lost or are missing that piece of the puzzle to really understand our own tradition related to mental health. And as I see already some of the questions and comments in the chat box, which we'll hope to entertain, that also talk about, it's not just us, it's the whole world really that has lost that very key to discussion and piece of the puzzle related to Muslim contributions to mental health, and especially those that are coming from Islamically indigenous practices, meaning that they were unique and not found even before Islam. Right, so that's even more than just Muslim cultural practices, but Islamically indigenous practices, which I think is also very intriguing and interesting to talk about. Now, for Marwa and Beste, you both presented very beautifully a discussion on a specific individual in the 17th century who was tasked with mental health care and also oversight. And it was really interesting to see his book, in which you mentioned, and you had the table of contents there of the different chapters in his book, one of which focused on using the makam, the modalities of sound to be able to treat and heal. And then we saw how in the hospital system, which of course we could spend a lot of time talking about the Islamic hospital systems and how they had psychiatric units, psychological care, very holistic care that included mental health care. And it was so interesting to see a practical example of how they used this sound therapy. And you played for us also a piece that I understand is from that period of time, of what it would have sounded like. A recreation of what that would have sounded like. And that's also very intriguing, because there is a discussion and a debate, I would say, amongst many, on whether the maqam is something that is inherited from others before Islam, and Muslims kind of incorporated into Muslim culture. And is there a place for that in Islam, giving some of the debates related to music, which today we're not going to get into a fiqh or Islamic jurisprudence debate on this topic, but rather there is a debate in the circles, Islamic circles, on how much of this do you incorporate, and is it really indigenous to our roots? And what you've illustrated is that it has been indigenous to our roots. And not only that, but there was more than just the use of instruments, which typically is where the back and forth discussions and debates stem from. But it sounds like you're saying they're also using water sounds, like sound from water fountain and water sounds, meaning nature sounds, bird sounds, and also using voice, like the adhan, like you mentioned, and the recitation of Quran. And these kind of different modalities are all incorporated into this, what today we call music therapy, but part of this Islamic version of music therapy. And so I hope you can comment about this a little bit more, because I do see that there are some questions related to this. And I'll wrap up my concluding remarks here, in that I just want to say that how pleased I am with all the work that I see happening. I want to give incredible kudos to our team that's been based in Turkey and back and forth, particularly Marwa, who's come back and forth between the US and Turkey many a time now, and Beste, who's there, and the rest of your team, because they have been combing through artifacts and manuscripts in Istanbul to really understand and pull out a lot of this material that is not yet translated and not yet widely available, but we hope to make it so. And so thank you both so much for all of that work and your team, and Rümeysa for really showing us a modern day implementation of this. And with that, I'll conclude my remarks and open up the time for a discussion. All right, so with that, we'll go ahead and open up this chat box, and I'll start giving some questions to each of you on the panel. And please, for our attendees and audience members, please do also put in your questions so that we can address them. So you have a couple of questions here, and we'll start with you, Rümeysa. There is a question related to really using and incorporating music therapy when working with children, considering that there are children who in the community who have had very deep trauma. Can you comment on this?
Yes, sure. This type of music, specifically the makam music, has applied a lot of population in our systematic review, which was published last month. And I can share with the group on the Woha app, inshallah. So it has shown that there is 21 trial which was conducted in Turkey, and they have some children population as well. So I think in my understanding, there are plenty of studies, but they are not published yet with the children population. So yes, yeah, I think this makam music, specifically this makam music, not the Sufi music, can be applied to children and which have some mental difficulties, yeah.
Very interesting, very interesting. And I there's so much room to really do a lot here with a lot of these trials. And it's kind of, I feel like if yours goes through as one of the first with approval, then we might find kind of a series after this. In fact, potentially you might have an entire career dedicated to this.
I hope so, yeah.
Oh, well, very nice. Thank you so much for that. There's also a question, let's see here, related, and this could really be for anyone on the panel, on research or even practice around music therapy or therapy in school settings, also with children, but what about in school settings? Considering that maybe children might have even more positive effects from the maqam music.
I think there is one study related with the university students, but I haven't come across, for the high school or the primary school children. So I hope as a future direction we can use this idea. This is very promising. Yeah, thanks.
Got it. Yes, very good. There are also some questions related to distinguishing the work that you found between Islamically rooted music therapy presented by live musicians versus contemporary recordings. Is the presence of having the musician in place a contributing variable?
I think Merve will answer this question better than me, but according to my research, I can say seeing the musicians and the environment help, increase the effect of the music to the patients. But in my research, I use the records. So probably Merve and Elif will enlighten more, because Şuuri mentioned this in the book, I guess. Yeah.
I can mention a very popular historical example from Evliya Çelebi, who describes very well in detail how he observed a group of 10 musicians performing for the mentally ill in Edirne. And it basically encompasses both many variety of instruments and also musicians. And we unfortunately don't have very much detail how they implemented the music, and for instance how long, and whether they were regular sessions, etc. But we see from the historical sources that they were existing professionals, musicians actually, who were coming to the hospitals and performing for the patients. And also sources mention that physicians were in charge of the treatment, and they were observing, and they were basically regulating the process. They were not the ones performing the music for the patients. As in today, for instance, a music therapist will be personally involved to the process. But at the time, we know that physicians were in charge of the treatment, but not actually the performance of the music. And I would assume, having the musicians actually live would make a difference, but we need to see with more experimental designs, inshallah.
Very, very, very intriguing, actually. And it makes me really think something important here, Merve, about this concept of that the physician wasn't the one doing or the clinician, if you will, wasn't the one doing, performing the music necessarily. And what it means to me is that there has to be a holistic and very kind of, if you will, interdisciplinary team of people who are working with the patient at hand. And so, today, if we look at it today in modern practice, what would that look like today? How do you take, a number of people who work all together in the care of this person?
Well, I'd love to see in reading about the history of the Islamic hospitals, because we see, as you mentioned, a very broad team actually who is taking care of with the patients, and it's a very diverse group actually, and it starts with the physicians, it has the pharmacologists, and it has the particular cleaning staff, the security staff. Those are also included to ensure, they mentioned in the recordings, to ensure that the patients felt secure with these guards, for instance, in the gates, or with separate locks and keeping their belongings there, etc. These are all taught details. And we have also musicians coming to the hospitals performing. We see from the recordings actually specific characteristics for the staff who will be working in the hospitals, who need to be gentle, for instance, who need to be respectful to the patients, etc. These were all written in the Vakf deeds, and we can discuss a lot more in this topic, but as you mentioned, it's a very large group of people. And I can give an example from a French traveler actually who was writing about his observations in one of the hospitals in Istanbul, and he was amazed by the organization of the hospital and how the physician was coming regularly and recording the conditions of the patients and how he was in charge. And he mentions this very explicitly. This is the place I have seen so far the most organized hospital ever. So I think this is also important, that to have so much people from so much different backgrounds and also working in harmony for betterment of the patients.
Absolutely, absolutely. I'm so glad you said that, because I think, again, speaking of historical understandings, and there was a question earlier that talked about, correcting people's perception. And I think the question specifically said, sometimes many of us have been in classes with our own professors and we've had to, kind of say, actually, that's not exactly how the story goes, right? Particularly on the history of, you know, mental health historically, of psychology historically. And so I love what you're bringing up, because you're talking about not just is there a team of people who we today would consider like clinicians or care providers. So you mentioned like, you know, a physician or, you know, the nurse, or you mentioned the pharmacologist, right? The person who's compounding medications together. But I would also add that the team is even more extensive. We find in the books that you're referring to the descriptions in which there is the dietitian who's figuring out meal-specific meal plans specific to each and every person based on what they are dealing with. Imagine that, right? And then in addition to that, you have like today we call a social worker, somebody who's figuring out what the person needs while they're in the hospital and after they are discharged. And then you have the religious leader, who comes a part of this team also to help and see if there's any spiritual needs that the person has as well. Today we call this person a chaplain, right, in the hospital. And subhanAllah, you talked and touched about how in like the music therapy example, where you also have people who are coming into the hospital complex, right, into the hospital system historically in the Muslim lands, in order to also offer, well, you know, sound or song in order to really help also in the healing process. So we're talking about a very wide, large group of people who are very interdisciplinary, working together to really help a person who is in need in this way. And so I want to just say and thank you again for this kind of research, because I'm very excited, and maybe it would be a good place here to say that I'm also very excited that you and I will be working together on this new upcoming book on hospitals in the Muslim lands, and really highlighting all of these different findings that we're discovering through manuscript research, and exactly this, that interdisciplinary team and the kind of resources that were there. The quotes you said of the French traveler or other European travelers who would come into Muslim lands and be amazed by the work that was happening there, and in their own diaries, which we still have to today preserve, really documenting what they saw. And there was no bias there, because they weren't of the Muslim group, they were observing from as an outsider. And so you have even more of an objective understanding of what was happening in that period of time. So much to learn, and so much, unfortunately, that we have lost, but we hope to revive, inshallah. Very good, alhamdulillah. We have another, I thought this was actually a very interesting question. I'd love your insights on it. It relates to, and this kind of now bridging into kind of modern day discussion, there's a question related to other forms of music. And this question in particular, I won't read the entire question, but the gist of it relates to hip hop and rap, and using modern forms of music in this way. And this particular person is saying that he uses this in order to help heal and work with youth to teach them social justice and global awareness and the rest, and really address trauma and cultural social awareness. And how would you interpret a question like this and what you've taken and learned historically to the modern day? Can you make a connection between the two?
I think in the music therapy interventions, so the cultural bond quite important and have very special, the role in the therapy sessions. So this is why all the cultural bonds of the person should be taken account. And as Merve also mentioned, person-centered therapies during the Ottoman hospitalization of the patients is quite very widely used and very professionally used if we compare to the other part of the world at that era. And we can say, yes, I mean, why not hip hop culture or the rap music? I mean, why not we can't use in the Islamically way, I can say, yeah. It is the words and the music as well, the rhythm of the music and all the hip hop things, and the importance should be given the words, what we are using for the words and what we are using for the music as well. This is my comment on the issue, but maybe Merve and Elif have something to add.
Maybe I can briefly say that whether music is permissible or not, I'm not going to the, I'm not like in that position about the like fixed discussion, but those like Ottoman scholars were also doing those discussions, like we see in Şuuri's work as well. He was discussing about like different methods and how they perceived music, and he emphasized that music is permissible for remembrance of Allah, like it was as a tool, as a spiritual tool to remember Allah. And we also see in like other Islamic sources that music is when it's done with adab and it's like done in the correct way and the like for the well-being, it's considered for some as permissible. And I think it resembles to the active music therapy. Rümeysa, maybe you can comment on in the contemporary world, like actively people like patients or like they were involving in it. And just a small note about like having this music therapy, Islamically rooted music therapy for the well-being of the non-Muslims. I would say that it's probably the case in the history too, because we know that hospitals served non-Muslims as well. It wasn't like a religiously grounded institution by any means. We know that even a passenger who got sick can go into the hospital and got admitted. So it was not only Muslim patients, we can say from the sources that there were also non-Muslim patients. And we also see specific like makam suggestions for specific ethnicities. And there were some non-Muslim ethnicities, like mostly non-Muslims. And we can
for
see
example,
that
Christian Orthodox, Şuuri also provide a makams implementation for Christian Orthodox or Jewish communities as well.
Yeah, I think those details are also important when we consider the like music therapy in Islamic tradition.
So it sounds like what all three of our panelists are saying really is that there has been a long history of this, and some of this, if you will, we can say it is particularly like with the maqam, if we say those as an example, are types of modalities that were in existence from before Islam. And once in the advent of Islam, some of it was incorporated within Islamic cultures and use. And others were new modalities that were very unique to Islam. Can you speak about the difference between the two, particularly here also the use of Quran or Adhan or other kinds of uniquely Islamic sound that was used as therapeutic?
Actually, we are hearing 5 times a day makam music from the minarets, you know, the azans all around the world, just reciting in makams. But some of us, unfortunately, we are just not as familiar as at the old times. We don't know what makam is. And azan and the Quran recitation all have a makamic nature. So we can say, yes, all those is purely Islamic. I can say the musical mosque musics we call in Turkish. So those things also have makam music in itself, even though we don't realize. So yeah, that's
Rümeysa, can you speak, because there's some questions specifically asking you about this, kind of a little more elaborating, where, like you said, there are people who don't recognize that if you travel across the Muslim world, the adhan is given differently and essentially using different modalities, meaning the maqam. And so when you think about what it sounds like in Istanbul versus what it sounds like in Mauritania, which actually is quite different, versus what it might sound like in a different part of the world, what are they doing to make the same words, which are the adhan, sound differently? Can you explain that?
This is actually also the culture has a very important role in the reciting the azan as well. So specifically, as I said, Mesopotamia lands, the Syria, Turkey, even the Asia have the makam culture in their cultural bonds, their cultural roots, and most of them, even though in the Indian musical theories have makam in their cells. Surprisingly, I heard Jewish culture has a kind of makam things in their daily, the rituals as a part of daily rituals. But when we move on to Africa or South Africa or the European culture, they are just integrated azan, their religious rituals, to their culture, the music, and they recite this religious things according to their culture. So I can say the difference depending on the cultural things, as like the coming from the using the hip hop for the people coming from the hip hop culture, or makam music, who has a bond with the makam music, a person with a bond with the makam music.
Beautiful. I really appreciate this, because there are circles of people who will hear this or even see the title of this topic, as we said earlier, and say music therapy in Islam and go, oh, no, that's not part of our tradition. and here we're going into nuance. Like, we're really trying to explain, look, even what you consider to be very uniquely Islamic practices like the adhan or recitation of Quran and others are depending on the culture of where that person is. The modalities in which they're reciting Quran or even the adhan is actually using maqam that is more based on their locale, their culture, kind of incorporating that in, which is why the adhan of West Africa sounds different than the adhan that's in Mecca. They actually do sound very different, but they're both the same words of the adhan. The way Quran is recited across the world also sounds differently depending. Now, because of globalization, you find a lot of people reciting Quran kind of that sounds the same. However, historically, not the recitation of Quran didn't always sound the same across lands and continents, right? And I think this is what you're picking up on here.
Yes, yeah, beautiful. Thank you.
MashaAllah. You do have another question of interest, and this is really open to the entire panel, about has this work on sound therapy, music therapy been codified? The science of tones and rhythms that promote healing. Has there been a codification of this yet?
I'm not aware of any codification yet, but yeah, why not in the future?
You're right. Why not? Merve, were you going to say something? Go ahead.
No, just completing it. Like, I think we are in the initial phases of like actually diving into this in more detail, and we have some like medical studies, like doing some music therapy sessions for people under surgery or like just post surgery, etc. But the details of how makam actually worked on people, and it's like psychologically, it's kind of starting. Now, maybe Rümeysa can comment more, but this is what I see in the literature.
Yes, yeah, there are several assumptions of the makam music, the mechanisms, mental health mechanisms behind the makam music. One is the spiritual relationship of the makam music, which has a very spiritual component on it, related with the makams scales itself, and also instruments used in the makam music. And the other one, the nature-based relationship, it's just remind the people when they listening to makam music, combining with the water sound and also bird sounds around the institutions, it just reminds people the feeling part of the nature, and this gives the holistic meaning of the makam music to the people, and they felt more relaxed. And it has also works as a mental distraction, which is also common mechanism of the all music therapy. So I can just comment of the mechanisms behind the makam music as like this, yeah.
I think that's really great, and actually, and I agree with the comment here that says very promising. Yes, mashallah. And there's also another comment here about how, and I actually have seen some of this literature as well. That I agree with you, it's emerging. It'll be really interesting to see what happens and comes of it, of starting to, like this person says, playing Surat Rahman, for example, for a religious depressed person, right? And how is that effective or helpful? Basically picking, depending on, the kind of condition that a person may have, can you then correlate it with what you might have them listen to help the healing process? Are you able to comment on that, inshallah?
It is still depending on the person, actually. I'm just imagining using this Surah Rahman in Turkey with the Turkish people. All of them know this is the Surah Rahman, but they don't know even a word in the, the Surah. They don't understand Arabic. They are speaking Turkish and they don't understand, but they are just hearing the voice of the recitation of the Quran, and this heals them. And I think one of my friends completed her PhD on this. So he just make people listen in the UK. People listen to Quranic verses without even looking at the understanding level of them, the cognition level, different people to people, so person to person. So it shows very promising results. So future direction may just going through that way as well. This is a very exciting topic to discuss.
Yes, yes, definitely. I mimic your excitement because I think there's so much here, and it goes back to that other comment earlier. And I don't know if the person in his dissertation, he had both Muslims and non-Muslims listen to the Quran. Did he? I wonder. Do you know?
Not actually. I think she just recruit all the Muslims, not non-Muslims. Yeah.
No problem. But I think it would be so interesting, and actually it would be very helpful to see, because we find anecdotally stories of this, of people, and you see, I mean, there's, YouTube clips and all whatnot, where people are listening to the Adhan for the first time or Quran for the first time, and they have a very, clear emotional reaction to it. And often it's one of amazement, surprise, and sometimes it's calming, sometimes it's tears, and so on and so forth. It's unexpected, basically, is what you often find in these clips. But I do think it's very interesting to see, because then you can say, look, there is something healing about this in the way you recite it in this way, depending on the condition, that can be healing regardless of who is listening to it. And then there is the other part of it is, do you need to understand what you're listening to actually heal from it? And so you can see where there can also be some, well, conflation in the research, but needs to be really elucidated and figured out what's what. But lots there, lots happening there.
Yeah, absolutely.
And I there's a wonderful quote here from, it looks like somebody cut and paste from a section from the Grand Book of Music. And I agree here, because this is something I don't know that we specifically touched on, but it's very helpful. The different kinds of maqamat of, for example, the one that would trigger happiness versus the one that helps with sadness or pain, or one that relates to freedom, romance. I think this is so interesting because in the historical works I was speaking about earlier, and I hope inshallah this will be featured in our upcoming book, inshallah, so look out for that book, inshallah. It'll be published by Routledge, inshallah ta'ala. And one of the things that is very interesting in the research that we have found, yes, is that they use different kinds of maqam for depending on the mental health condition of the person they were working with. So if some of it was very down or depressed, they used the maqam that brought them up. And if they were kind of, it's funny to say happy, bring them down, but what I mean to say is like more like a manic condition, and bringing them back to baseline, right? They would use a different maqam, right? Depending on what's happening. An anxious person would be different than a person who's sad, and so on and so forth. And I think it's phenomenal work. And I hope that we can not just translate and speak about it, but potentially even replicate in the future. Very good, very good. And so in closing here, there's a couple of comments at the very end. I'm just going to make sure that we catch everybody's comments. A lot of people seem to be very excited by your work, mashallah. So thank you to our panel again. And really wonderful, people are commenting how it's wonderful to see some of the Sufi interventions related in psychotherapy. Others are commenting on the excitement of really bringing Quran into, or Adhan into the treatment process, to be more, for those who would like to see an Islamically integrated type of modality of care. Others are also, I would say here, there is people, one person commented that there's a reason why people go to concerts. And I agree with you that yes, I'm sure it has an effect. I just wonder if it's not quite the effect we're looking for here. whereas for somebody who could really benefit, in healing and treatment, that there is alhamdulillah, other modalities, potentially more Islamically indigenous, to help us forward, inshallah. So with that, I think we've reached the end of our time for our panel, and also for our questions and our discussion. I thank you all very much for a very, very insightful conversation. It was wonderful to spend time with you. Thank you for both Merve and Beste, who are both here from Turkey at the moment. And Rümeysa, are you currently in the UK at the moment? Or are you in Turkey as well?
Turkey. Yes.
You're all in Turkey, mashallah. All right.
Yes, yes.
So our panelists are on the other side of the world, mashallah. And I am here from San Francisco, and it's been really a pleasure to be here with all of the attendees. Please keep these lovely researchers in your prayers, and we hope to see amazing work from all of the team moving forward. And for those who'd like to continue following some of this work, we'll definitely be featuring it at the Stanford Muslim Mental Health and Islamic Psychology Lab, in which the two presentations today have been partnered with the lab and all of these researchers. So we do look forward to more work from all of you and our attendees kind of staying in touch with us. And we'll see you around. Take good care. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam. See you, inshallah. Thank you very much.
Thank you.
Okay, thank you. That concludes our panel on music and mental health. So hope to see you all at some of our other panels later on. Assalamu alaikum.
Wa alaikum salam.